So can you see that, right? Yeah, right. So generally this is what it is. So if it is Medicare, we have to select A and B, right? So these are the two things which normally we select. But whereas when it comes to what we call when it comes to Medicaid and all, depends on the kind of designation what it has, it will be varied. So I'll be showing you the form relating to that COB coordination of benefits so that you'll be knowing. Just give me a minute. I'll be opening it. Coordination of benefits form. Now, can you see now this form? Can you see this one, Ram? Ram, are you there? Ram, are you there?
Yes, Raj.
Yeah. Can you see this form?
No, I don't see it. Now I can see something.
Can you see this form?
Yeah, now I can see it.
So this is
COB.
what generally COB. This is what generally the coordination of benefits form it is. So here we have to mention about the provider details as I stated just now back, sometime back I have told you. At the same time, we have to mention about the patient details as well. Followed by the patient details, we have to mention about the subscriber. Sometime back I have told you. Followed by subscriber details, we need, of course, date of birth, member ID and all everything. At the same time, here we have to mention the relationship with the patient. Because that person, whoever is the subscriber, may be relating to the patient as he may be a family person. He may be relating to that particular family. So that we have to mention about the patient details and all everything in this form. This is what generally it will be. At the same time, we have to mention about the employer group. From which employer group is this there belongs to? Because sometimes what will happen, these insurance plans and all everything will be sponsors by an employer. Okay, employer will be sponsoring this because the person who is working for a particular organization, whatever the health insurance plans, whatever the health benefits will be provided and all everything will be provided to the sponsor by the company itself. But when, if there is the case, if that is the case, I'm saying, right? So by the sponsor. But what generally the sponsor or an employer do? Employer is the person where they will come up with some customized plans from an insurance company. Right? So they come up with an insurance, customized plans will be available, and whatever the applicability is, whatever the eligibility is, depends on the kind of bandwidth which they have. So the employer group details has to be mentioned. If this is applicable, if applicable, this information will be mentioned, right? If this applicable. For example, why I'm saying, because sometimes there are some private insurance plans will be taken by the people where they may be self-employed, maybe because there are cases where they may be self-employed even, or they may be business people. If they are the employees for an organization where an employer is providing the healthcare benefits and all everything, so those details has to be mentioned. Otherwise, if it's a self-employed in business and all everything, this will be not applicable. So this point has to be understood. Next, here we have to mention the effective date of coverage, because whenever a healthcare provider is providing the treatment for a patient, usually they see, because effective date of coverage they will see, right? So whether that person has a valid insurance or not, and when it has started, so what will be the coverage and all everything they see. So effective date of coverage has to be mentioned here. This is what generally it was. Now here the type of coverages, this is what I said, right? So either the what kind of health insurance plans they have. If it is Medicare and Medicare, then it is different. If it is not Medicare and Medicaid, then it could be private insurance plans also. Otherwise, if we may be having some other student health plans, maybe that's all comes under the private insurance, like if they are any kind of student health plans or something. So those details has to be updated here. Followed by this, we need to mention the plan details. Whatever the health plan particular this thing is available. So the health plan details has to be mentioned here. Which plan these people will belongs to. Depends on that, whatever the coverages and all, everything will be applicable. To what extent, of the price these coverages are applicable, that will be decided. Because there will be some plans, depends on the kind of employment they were belongs to. They are applicable only for a particular percentage of amount to be reimbursed, not for the other this thing, right? So that's the reason why we have to mention about the details of the plan, what exactly it was. Of course, effective date of coverages. Followed by this, of course, health plan address, whichever the address a health plan has. Means I'm talking about a person, whoever is having a health insurance plan. Those details has to be updated here. Followed by this, we need to mention about the contact details of the people. At the same time, we have to see whether in what way this subscriber is related, followed by the kind of status they have, right? So are these people are active in state, or they are retired or something like, so that information has to be updated here. If the patient is a child, as sometime back I have told you, right? If a patient is a child, so their patient name followed by their date of birth, father's name, mother's name. So those details will be updated here as a. The third class is, it is divorce related, as you know, right? So if it is divorced and all that, if it is separated or divorced and all, so they have to mention about those details here, right? So that is one thing. And the next, this is where generally we have to see, because we have to see whether people have a valid Medicare insurance plan in the family or not. If it is there, for instance, when the family has a health insurance plan in context to the Medicare I'm talking about. If it is Medicare, which one it is, right? So is it Medicare A or Medicare B? Because Medicare C is an advantage plan which will be given by the private insurance organizations. So which was not applicable here. Of course, D is only for medicines and all everything drugs cost, so that won't be included here as well. But A and B are applicable because A is a plan which is for inpatient and B is for outpatient. Hence, these two will be included in this. Along with this, we have to mention about the reason of because Medicare ID number, followed by this, if there is any kind of disability or the kind of diseases a particular person has, that has to be mentioned, because this is the condition whenever it is mentioned, because in the year of 2010, in the year of 2010, there were some amendments happen, which is called Obamacare, right? So there was some Obamacare act was introduced in the year of 2010. Afterwards, it was named after as Trump Care. After that, it was named as Biden, right? So that is different. So in the year of 2010, there was an amendment happened, especially on insurance plans whichever is providing by the CMS department, that whatever the seasonal diseases will be included in it. Okay, seasonal diseases will be included. That is point number one. Second, there is a clause which was mentioned by the government in such a way, a person especially under the age of 14 years or so, 14 years, below than 14 years, request apart from insurance, because request usually insurance will be upon request. Insurance is not generally sales, right? Insurance upon request, insurance will be made for a particular person by the insurance company. That is completely their discretion, whether based on their underwriting policy, whether if it is eligible for them to provide insurance or not, usually decided by the private insurance companies, right? So in this context, what government has decided, not only the seasonal diseases one, second is that people whoever is having a age group of below 14 years, no acceptance of insurance shouldn't be rejected on the basis of the person whoever is having a disease. For example, below 14 years of age, right? Whoever is suffering with something, right? Just because of that reason, no insurance plan should not be rejected by an insurance company. This is what generally the resolution was made in the year of 2010, and of course that is still it is on force and it is working now. So that's the reason why whenever we are talking about Medicare, there are some reasons where family members have some disability within the particular family. At the same time, whatever
I lost your voice.
right, sorry, right. So those diseases details and all everything has to be mentioned here, right? So this is what generally we have to see, that this is, if they have a disease and all everything, that information has to be mentioned on the document. Along with this, of course, effective date, etc., etc. Followed by this, if there is any, for example, if this is a disease, something relating to this type stuff and all everything. So what kind of treatment they were undergoing, right? So is there any kind of transplantation was made, right, etc., etc. All this information will be mentioned under this. So this is what generally the coordination of benefits form, which normally we prepare whenever there is a process of payments, whenever the process of the health claim insurances and all everything we do in 837. Through in 837, there is some coordination of the benefits which has to be updated equally by an payer, which will be sent to the payer, which will from the provider to the payer, so that subsequently uh, payer will be if there is any other claim adjudication queries they wants to resolve and all everything will be resolved. Finally, they will do the payment, right? So that's what generally. So the first step 837 is the form which normally we prepare the code which will be prepared, where hospitals will be send information through the clearing houses, because clearing houses are an intermediary, you know it. Even the bank transactions, whenever we get the salaries or etc., etc., all these things happens through clearing houses itself. On that particular date and time, automatically the money will be credited to the recipient's account. That's what all this ACHS and all. So even the facets application, what are the facets application we are using? These clearing houses will be integrated with the facets application itself, because there is a distinction between clearing houses as separate and facets as separate, because clearing houses are not the part of facets application. Do you understand this, Ram? Are you following?
Yeah.
Ram, right? So clearing houses are not part of the facets, because facets is a form for hospital, the care administration we are following. Clearing houses, there may be separate applications which will be used by the organizations. Either it could be hospitals or it could be a financial institutions like banks and all everything. Clearing houses applications will be as separate, which will be managed and organized by the medical billing companies, because there will be medical billing companies which will be works as separate. So their responsibility is to update all the medical bill records and all everything for a provider. So those people will maintain this clearing houses and all that. So that is what generally these people responsibility is. Through this clearing houses and all, this information will be sent to the payer. From there, if there is any kind of adjudications and all everything requires through an 835, this adjudication will be taken place, where either this adjudication process may be something connecting to what we call maybe something belongs to maybe the cost of the procedure or the cost of the treatment, right? Whatever it was mentioned and all, if there is any adjudication, any queries they want, right? So if they want to get any kind of query, solve any kind of queries and all everything will happens in the 835. Followed by this, once everything they feel that whatever the information was given right or not, if it is accepted, then automatically through this clearing houses, through the same clearing houses, wherever the registered bank details was updated in the records, through that generally hospitals will receive the payment from the payer subsequently. So this is how generally these are the four general stages which normally we see whenever we are talking about 835 and 837. Okay, I'm not specifying anything relating to 271, 275, all that, because those are all different. So because these are the two codes which normally we uses for claims sending and as well as claim payment receivables, followed by this in between